My name is Ivy Agbanglo-Hines. This presentation was prepared as part of the Health Informatics Program, HAP 709 course on healthcare databases at George Mason University, Department of Health Administration and Policy. Heart attacks, strokes, kidney failure, dialysis. Diabetes is a disease that occurs when your blood sugar or glucose is too high. In 2015, 30.3 million Americans, or 9.4% of the population, had diabetes. Of the 30.3 million adults with diabetes, 23.1 million were diagnosed and 7.2 million were undiagnosed. 1.5 million Americans are diagnosed with diabetes every year. It's estimated that 1/3 of people with diabetes don't even know they have this condition, and the most common form is type 2 diabetes. Symptoms aren't always displayed. For this, it is so important to get screened for diabetes and take steps to prevent it if one is identified to be at increased risk. This simulated data is from a major healthcare institution in the United States. Queries run against 17,443,442 records, which were merged from 4 CSV files and imported into the database for analysis. This data set was cleaned of any improper formats, duplications, and utilizes patient data from ages 40 to 99, condensing our data set to 741,365 unique patients. The data comprise of patient IDs, diagnosis codes, age of diagnosis, and age of death. According to the CDC, diabetes is the condition in which the body does not properly process food for use as energy. Most of the food we eat is turned into glucose or sugar for our bodies to use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin to help glucose get into the cells of our bodies. A comprehensive set of diagnoses were used to predict the presence of diabetes or the risk for diabetes. There were 5,342 diagnoses with at least 29 observations. An age range between 40 and 99 were added as a concentration of the analysis. Provided are examples of 10 obvious predictions. They are diagnoses that always occur with diabetes or have the word diabetes in their name, but were not used as a definition of diabetes. Shown are examples of 10 rare diseases that are predictive. These are diagnoses that occur more than 29 times, but less than the other diagnoses. These are examples of 10 most predictive diagnoses that are not obvious: dysthymic disorder, other primary cardiomyopathies, unspecified hearing loss, etc. We use naive Bayes data mining to aggregate data from individual diagnoses to overall risk for diabetes. This is known as posterior probability, that A occurs given B. This is the likelihood probability of B occurring given A. This is the prior probability of A occurring independently. This is the prior probability of B occurring independently. Meet patient 76. Displayed are 5 diagnoses with their corresponding likelihood ratio, and their description and the calculated odds for diabetes. The highest likelihood ratio is mixed hyperlipidemia, and the odds of diabetes is about 2.58. The interpretation of the likelihood ratio changes around 1. Values 1 or larger increase the odds, and in this case, it's diabetes. The data was split into 2 sets. A random number generator was created using the patient ID as a seed. 80% is randomly selected into what is called a training set, and the rest of the 20% into a validation set, which we cross-validate. The training set is where likelihood ratios are calculated. Predictions are made in the validation set. Cross-validation protects against modeling noise in the training set. Therefore, any predictions that occur after diabetes are ignored. The receiver operator curve displays the cross-validated accuracy of predictions. It plots sensitivity and 1 minus specificity observed at different cutoff points. Big data is a term that describes large volumes of data. Analysis of millions upon millions of records is best organized and analyzed utilizing an electronic healthcare system. Calculation of likelihood ratios, predictive models, odds, and probabilities, along with queries and databases, can have a positive effect on patient preventative care.